Hello friends, I welcome you all on my YouTube channel Talks on Homeopathy. Let us learn and understand homeopathy together. In this video, I am going to discuss with you a repertory published and compiled by Dr. S R Phatak, which is known as a concise repertory of homeopathic medicines. This repertory is alphabetically arranged repertory which is not having any particular chapters but only having rubrics which are arranged in alphabetical order. The first edition of this repertory was published in 1963 and second edition was published in 1977. The third edition, which is also called as revised and enlarged edition, published in 2000. The philosophy of this repertory is based on philosophy of a clinical repertory. Clinical repertory where you are going to find clinical rubrics and clinically verified medicines. This repertory also belongs to a class of a general clinical repertory, means you will find the symptoms related to whole organism in this repertory. As we discussed earlier, this is repertory arranged in alphabetical order which is not having any particular chapters. In plan and construction, we can divide this repertory into three major parts. First, we will have a preface part where you will find the explanation regarding philosophy and arrangement of rubrics by author and by publisher. Then there is a section of remedy abbreviation where you are going to find the list of remedies and their abbreviations. And then lastly we have a repertory proper part. This is the list of abbreviations. From here the main portion of a repertory is starting. The first rubric of this repertory is abdomen. And the last rubric of this repertory is zygoma. So now we are going to discuss the arrangement of rubrics. So in this repertory, you are going to find out the rubrics arranged in a 5 different levels. On a first level, we have a main rubric where the rubrics are printed in bold and capital letters. So in this photograph, you can see the rubric of females, which is known as a first level rubric. Then you have a second level sub-rubric which is printed in a bold letters without any denotation or a bullets. On a third level, you have a rubrics which are printed in a simple Roman letters but denoted with a dot. On a fourth level, you can see a rubrics denoted with a dash. And on a fifth level, we are not going to have any denotation, but we will just find that the fifth level rubric is written with a one space just below to the fourth level rubric. Here also you can find the first, second, third and fourth level of rubrics. This is the first level rubric is eyes. Second level, motion of. The third level where you are going to find out the rubrics denoted with a bullet of dots, where you are seeing over here is a rubric of constant, direction and so on. The fourth level rubric is denoted with a dash and fifth level rubric are not having any denotations, but you will find one space under the fourth level rubric. Now in this repertory, you will find physical generals as a main rubric which are scattered in a repertory and you have to find out them in a alphabetical order. So here you are seeing that aversion rubrics is given alphabetically. Also here you can see a rubric of craving. Now also the important part or a location are given as a main rubric in alphabetical order. So in this photograph you can see the location of choroid, location of clavicle, and with the sub rubrics of clavicles. So here you can see the main rubric head, which is given as a right, left. The location of nasopharynx, location of deltoid, and after that in alphabetical order you will find the one physical general, which is desire. Okay, so you can see over here alphabetical arrangement of rubrics, whether they are considering the group of physical general, location, mental. Okay, so you will find the all rubrics are written or included in alphabetical order. Here we have a clinical condition, retinitis, rheumatism, and one more location is there, ribs. Clinical terms are used as a main rubric. In photograph you can see anemia, then anasarca, aneurysm in alphabetical order. Then we have another clinical term, angina pectoris. Again we have epilepsy, appendicitis. Now for rubric of location, the sides are given where you will find the right always first and then left, upper always first then lower, and it is not in alphabetical order. In photograph you can see there is I have a rubric of legs, lower limb, and the side sub rubrics are given first right and then left. We will also find the mental general rubrics scattered in this repertory. You can see the rubric of childish or foolish behavior. Here you have more mental general rubrics like discontent, discordant, disgust, disobedience, etc. So every rubric you will find in this repertory in alphabetical order. Now indications or some reference regarding a particular rubric is given in a bracket just after the rubric. So here you can see eruptions, in bracket you will find tendency to. So the list of medicine denotes that the patient is having tendency towards certain eruptions. Also there is one more example. We have a rubric of bluish purple, where you are seeing that the in bracket we will have a discharge, discoloration of skin. Okay. Then regarding modalities, the particular modalities are denoted as a aggravation and amelioration, where you will find the first letter of aggravation and amelioration are given in capital letter. Okay, so here you can see the lying, aggravate and ameliorate. You will find that only A is given in a capital letter. Also milk, aggravate and ameliorate, motion aggravates. Okay, so this means this rubric is related with a particular modality. Now if we have a general modality, then the general modality is denoted with the capital letters of aggravation and amelioration. Okay, means we will find the aggravation and amelioration, all letters are given in a capital letters. So you can see in this photograph that leukorrhea aggravates and leukorrhea ameliorates. The typography of aggravation and amelioration are given in a capital letters. So this means this modality belongs to a general modality. Also you can see one more example of modality, general modality, where we have a bathing, cold, aggravation and amelioration. Okay, another example is lying in, aggravation and amelioration. So like that, wherever you are going to find a capital letters in aggravation and amelioration, you are going to interpret the modality as a general modality. Now in repertory, at some places you are going to find out the rubric or medicine are containing a sign of plus. You can see over here is a rubric is air open ameliorates, and we have a sign of plus. So this sign denotes that the rubric or medicine added by Dr. D.S. Phatak, and it was not present in the original edition of Phatak's repertory. Now regarding the cross references, we are going to see a good detailed list of cross reference in whole repertory, and cross references are denoted with the word C just after the rubric. Now just I want to make a difference between some reference words and an actual cross reference. You can see here I am having two rubrics. The first is keratitis, where we are going to see the C cornea inflammation. So this is the cross reference, and on other side we have a rubric that joints swelling in water, and in bracket we had seen that hydroarthrosis. Okay, so hydroarthrosis is not a cross reference but a somewhat of a reference word for a rubric of swelling of joints in a water. Okay, here one more example is there. You can see the cross reference anxiety, C fear, apathetic, C inactive. Okay, then nips, C pain, twinging. So these all are we are going to interpret as a cross references. Okay, now we are going to see some very helpful rubrics of this repertory. The first thing, if patient complains some direction of pain or direction of complaints like sides going up or down, okay, the symptoms are traveling from one side to another side, so we are having a separate rubric of direction of symptom. Then if patient complains that my symptoms are occurring at some interval of days, so we have a rubric of days where we have a bracket periodicity, and you can find out the good list of all the alternating days and alternating weeks. Then if patient gives some symptoms that seems very strange, and also they are having amelioration from that particular position or a somewhat of a posture or a behavior, there is one rubric given in this repertory is a attitude bizarre, and which ameliorates. You can see over here is a sub rubric is bizarre attitude ameliorates. So you can take up this rubric when you are finding this symptom in your patient. Next is, sometimes we find expression like patient is not well since he suffered with particular complaint. So the rubric is given never well since, and you will also find a different sub rubrics like influenza, typhoid, septic fever in this rubric. We are also having a good number of sub rubrics in a prophylactic medicines or a prophylactic measures in this repertory. There is a main rubric given as a prophylactics, and in this you will find a different sub rubrics and medicines. Another one important symptom is back pain amelioration from pressure of stick or a somewhat of pointed part. There is also this very particular rubric is given in this repertory. Then we have one rubric, drugs abuse of. So bad effects of drugs, bad effects of any particular medications which the patient is taking from long continued period. And if you are thinking that the patient is suffering with a somewhat of a side effect or a bad effects, you can take help of this rubric and the sub rubrics given under the rubric. Then we have a rubric nose ulcers instead of menses. We all know the medicines for vicarious menstruation, but this is the very typical particular rubric where the patient is suffering with ulcers in nose instead of menses. Then empyema after pleurisy. Now another condition is the patient is having anxiety about business, and at that time where he is having a good flourished business. So here the rubric is given business worry though prosperous. Okay, so business is good, the patient is earning well, but still he is having worries about business. So you can think of this rubric. Then complaints aggravates in social functions. So there is a separate rubric is given society, where you have a amelioration, aggravation, and also the rubric prefers the society or prefers the group of person. Next condition is patient with irresponsible behavior or not behaving in a responsible manner. There is a responsibility, inability to realize. The rubric is given in Phatak's repertory. Next is expression as if he had tired or since long or since birth. Okay, some patients are going to express this kind of words in front of you. So if you know, you can pick up those kind of expressions, and also you have to know which repertory you are going to select for this particular kind of rubrics. Okay, then time passes slowly or quickly. You will see that time sense changed, and in this rubric you will find this particular sub rubrics like passes too quickly and too slowly. Now I am going to use a particular software, and this software is from Homeopath Zomeo, and we will see some more important rubrics in Phatak's repertory. So here we can have a aeroplane flying aggravates. Okay, so very recent condition, you can use this rubric. Then alterations of mental symptoms with nervous or physical symptoms or with physical symptoms. Also we have anemia. In anemia, I would like to highlight the anemia from hemorrhage or pernicious anemia, which is given in very less number of repertories. Also we have a rubric antisocial. There is one rubric which we had discussed earlier, is a society aggravates, but antisocial is a totally different rubric from society aggravates. Also we have a condition athlete's foot. So it is a kind of a disease where you are going to have a fungus infection in or over the patient's sole or foot. So the person or the individual who are having more use of shoes, and the particular kind of environment is going to arise a fungal infection, in those person you can look for this particular kind of medicines and rubric. Also one condition is there, barometer. So barometer is the person is having a sensitivity towards both the height of temperature or the change of temperatures. Okay, there is a condition bilharziasis, which is a somewhat of a worm diseases, infestation, worm infestation. We also have a colitis, mucus. Now another clinical condition which is we are going to see in our day-to-day OPD with LRTI or upper respiratory tract infections. It is a most difficult symptom or a complaint to treat according to me in day-to-day practice. It is a respiratory infection with cough. Okay, so in this repertory we will find a detailed sub-rubrics of a condition of cough, and you can use those rubrics to find out a medicine for your patient. Also we have a list of cravings. Then we have a desire certain things but opposes when offered by other. Now this rubric you will find only in Phatak repertory. Okay, So person is having desire, but they are going to refuse when some other person is going to offer the same thing. So this is a very typical particular rubric. Now doubting on people, you can say it is a suspicious, not having trust, mistrustful, but this is a very peculiar particular rubric you will find only in this repertory. So doubting on people. Then dreams of care and toil. So this rubric you will only find in Phatak and in Gentry's repertory. Now drinks hastily. Drinks hastily you will only find in a Nair and Phatak repertory. Then drinks in sips of, or drinks with sips of water. You will find a complete rubrics of drinks which ameliorate, which patient is desire, which having not much tolerable. So in this main rubric you will find different sub rubrics of cold drink, hot drink, little drinks at much, etc. Another rubric is Dropsy of Newborn. This rubric is only given in Phatak repertory with only 5 medicines. Also dropsy or edema after hemorrhage. There is a rubric of dropsy with numbness. Then dropsy after sprain. This rubric is only you can find in Phatak repertory, which is only 1 medicine is listed in this particular rubric. Dropsy with profuse urination. So very less number of repertory you will see this covering or including this very typical rubric. Then we have a forceps delivery. Many repertories are there which is including this kind of a rubric. Okay. Maldisposition of a fetus. The Phatak repertory is only 1 repertory which is having this rubric. Then the rubric is related with the food and drinks, where you are going to find out aggravation and amelioration. So you will find out a detailed list of, and mostly you will find that day-to-day food items are listed in this section. Then we have a rubric holding the attendant. Also one most important clinical condition of nowadays, and you will see so many patients having both the polarity of complaint, the high blood pressure and the low blood pressure. So both the rubrics are listed with some peculiar clinically verified medicine you can use whenever you want to prescribe a medicine on the basis of clinical data. Then again one condition is there, cervical spondylitis, and only 1 medicine was listed in this particular rubric, is a acid phos. Next we have a rubric of moonlight, aggravation, amelioration. Then there are some rubrics which are very peculiar or typical and given in this repertory. Rising and turns to right side whenever the patient is rising. Now let us discuss the adaptability, or in which cases or at what level you can use this repertory. So first you can use this repertory in a clinical cases where you are finding the clinical symptoms more, or where you have a more number of common and some peculiar rubrics related to a disease or a patient. Then cases with more general symptoms, you can also use this repertory. Cases with very peculiar particular symptom, and also in emergency conditions this repertory is useful. Working method of this repertory is you can work out a case by adopting a two different method of repertorization. The first is clinical method, where you are going to identify the determinative symptom and basic symptoms, and the second method is that the very systematic method of repertorization that form the totality covering the following symptoms. Either you can look for characteristic generals, either you are going to add characteristic particular, or you are going to add pathological symptoms. Uses of this repertory: there are many clinical rubrics are given, so you can easily help or easily take advantage of this clinical rubrics in your clinical practice. Then in each rubric, the particular location, sensation, modality and concomitants are given. So you can work out or you can find out the medicine whenever you are having a complete symptom also. The information is taken from authentic sources as well as from authors' own experience. So you will find the data which is more clinically verified. The author has put forward a few new readings from his own experience. So the rubric like blood pressure, bronchitis, bronchitis, colitis, you can find easily in this repertory. Though it is a very small and concise book, but it contains many number of rubrics. Another particular thing where you are going to see that it is having a symptoms where you are analyzed the general aspect from different particular symptoms. The example is there that patient is having somewhat of a pointed pain in different locations. Okay, so you can analyze the symptom on a general level and you can interpret a symptom like that patient is having sore and painful spots. The rubric is given in this repertory. Prophylactic rubric we had seen, it is given a wonderful sub rubrics you can use whenever you want to use. Also you are going to see the sphere of action, means rubrics of location, so you can use also. Successfully you can manage the acute cases because we are having wonderful list of rubrics and all are verified clinically. Cross references are given with many rubrics, so you can also use one rubric instead of others. And medicines graded in 3 marks, so you can easily compare the marks or intensity of medicines. Limitation is concise repertory, so very limited use is there. You have to evaluate your use of repertory and you are going to use this repertory in particular cases. Another point is there is no proper index is given, so there are times you will feel that you are not very easily finding out or hunting a particular rubric because you have to look for alphabetical arrangement. There are no chapters, so you are not going to locate a particular chapter of a particular symptom and then you are going to search. You have to go for alphabetical arrangement and have to search a rubric in alphabetical order. In most of the rubric, indicated medicines are very few, so not suitable for systematic repertorization. No particular arrangement of sub-rubrics are kept uniformly. This problem you are going to find out at some part of this repertory, but still this is making a somewhat of a beginners or a new users arised with a somewhat of a confusion regarding this point. Many clinical rubrics only have single medicines, like we had seen that symptoms of a cervical spondylitis, and some abbreviation of medicine is confusing for beginners. So this is a very basic primary information regarding Phatak's repertory. Start using in your day-to-day practice, so you will become more acquainted with this repertory and you can use this repertory in a better way. For more topics and information like this, you can visit my blogs or my YouTube channel. Till then, keep learning. Thank you.